Today, I'd like to address a question that I often receive from people who are newly aware of their social anxiety symptoms. And that question is, what exactly is social anxiety disorder? So I want to ask you, if you're listening to this right now, do you have intense feelings of discomfort and fear when you're in social situations? Maybe, you feel physically put off and you find these social settings unbearable. Millions of people around the world are affected by this social anxiety disorder. And oftentimes a doctor or therapist can help you treat the problem and allow you to live a quote-unquote normal life instead of being paralyzed by fear. It's hard to pin down the exact symptoms of social anxiety disorder, which is why seeing your doctor or therapist is so important. However, some common signs that you may have include encountering a number of fears. First and foremost, do you commonly fear social situations? You should see your doctor if your fears reflect the following: a fear that attention is on you, or all attention is on you. You may have a fear of making mistakes in front of other people. You may have a fear of judgment or being judged by other people. You may have a fear that everyone is better than you. You may have a fear of humiliating yourself in front of others. Or you may fear that everyone sees your flaws or your perceived flaws. And these fears may or may not cause panic attacks, but they certainly always cause intense anxiety. And this anxiety may lead to shaking, a pounding heart, blushing, sweating, stammering, nausea, dizziness, or a variety of other symptoms. And shyness, it's not the same as social anxiety disorder. A lot of people consider shyness and social anxiety synonymous, but they're not. While you may feel shy in certain situations, social anxiety disorder is physically debilitating to a person experiencing it. In fact, social anxiety disorder may take over a person's life if left untreated. And this disorder, it usually starts from childhood or maybe early adulthood. And it can affect everyone, regardless of race, religion, or gender. Although women, and this has been proven with statistics, are more likely to develop this disorder than men, statistically speaking. Social anxiety disorder, it's often found in conjunction with other anxiety disorders. And it's also common for a person with social anxiety disorder to try to treat it using drugs or alcohol. And this can lead to substance abuse. The best and only way to treat the problem is to initially see your doctor or therapist. And therapy and medication, they can help you work through the disorder so that you can live a healthy and socially active life. Cognitive behavioral therapy will help you grip your disorder so that you can learn how to make yourself calm and have less fear in social situations. And medications, they can be short or long term, and they can work to block certain inhibitors on a chemical level in your brain. Together, you and your doctor or therapist, you can find the perfect treatment plan so that you can take back control of your life. Now, you may have to live with social anxiety disorder for the rest of your life, but there are so many coping mechanisms, and having this disorder doesn't have to stop you from being happy. So, I want you to visit socialanxietyfix.com right now, because I have a free video series that's going to show you some amazing strategies and coping mechanisms to help you get through social situations and finally overcome this debilitating fear. I'll see you there. It's socialanxietyfix.com. Make sure you sign up for the free video series, and I'll see you on the other side. Take care.